everyone, welcome back to Jivaka's YouTube channel. Today we have a very special guest with us. He's a plastic surgeon and he's gonna help you decide this ancient question of going invasive or not invasive regarding your nose. So please introduce yourself.
Hi, I'm Dr. Kim. I'm a plastic surgeon, especially on the facial plastic surgery. I'm working at Gangnam. So
You know you're going to the right place when you go to Gangnam.
Actually, I'm doing no job every day, and actually I'm very specialized in the rhinoplasty. So I don't have enough faith to non-invasive things, but I can explain and compare about that.
When you do a consultation, you tell patients if it's better for them to get like invasive or like non-invasive.
Actually, it depends on the patient's need and recovery time and other things, and it also depends on the status of the patient nose, and also patient expectation and the status is also important thing to decide. So we don't have enough tools, especially on non-invasive things. We only have fillers and some threads and some botox procedures.
Do you personally prefer fillers or threads when it comes to...
Actually, I prefer fillers better because threads are, I think, threads are not enough to change the structures of your patient's nose. But fillers have volume effect. So if there is any supportive structures below, we can use effectively fillers to the nasal bridge or some teeth.
Well, when you say it like that, it's like it makes total sense, you know. Like, yeah, it's only a thread just holding something, but it's not changing your nose. Okay, so I have to be honest right here. Since I was little, I've always wanted to get rhinoplasty because I hate my nose.
You can be one of my patients.
Mom, you know it. Mom, you know it. I'm not... You told me that I shouldn't get anything done in Korea, but you know. So, like, what are some things that you would recommend for my nose?
Your nose. Actually, I can see some hump.
He noticed. This is not my imagination, people. I do have a hump. I'm not lying.
Sorry.
Yes.
There's some hump in your nasal bridge dorsum, and actually there's slight wider your nasal bony region.
He gets me. He gets me. I'm not crazy. He gets me. I like him.
So most of the patients are concerned about their teeth, nasal tip, and slight bulbous.
Mine is.
And
mine is. It really is.
Drooped columella and tip.
Yes.
And very small amount of flaring color. So that's your nose status. And we can correct that with the surgery, but we can't actually correct your nose status with non-invasive things.
But wouldn't the non-invasive make my nose bigger?
Sure, as I told you before, we have only fillers, threads, and some botox. We can use botox to your flaring color when we inject the botox to your here, which is like this. We can use botox, but it's very limited. And we have fillers and thread. When we inject fillers to your nasal bridge, it can cover your hump. Very small coverage on your hump because we can inject upper side and lower side of your hump, but it can be used for maybe male patients because male patients need also higher nasal dorsum. Nose bridge. And also men prefer more higher ratings here, and frontal nasal angle can be much higher. But for female patients, we can't. Actually, to you, I can't use filler. So.
Mom, I'm not a filler candidate. I have to cut it.
So I recommend surgery to you, such as hump resection to reduce the hump, nasal hump, and we call this lateral osteotomy to your nasal bone, to reductive rhinoplasty,
AKA breaking my nose so it can be slimmer. Another thing that I know about my nose is that the tip of my nose, you know, usually the cartilage are like together, but mine are separate.
Yes, a little bit separated your cartilage. So there's some, we call this boko in Korea. You have some bulbous tip. There's some reason to the bulbous tip, various reason to bulbous tip. In your case, you have a slight separated outer cartilage. So we call this lower lateral cartilage. So we have to gather and suture your nasal tip.
Oh, so not every nose is bulbous for the same reasons.
So some patients, especially in Asian, there's not separated outer. They have only thick soft tissues to the tip envelope. So in that case, we have to remove some soft tissues also.
So in my case,
in your case,
this is my nose. We will be shaving.
Actually, we have
the
hump. We have to resect
it, break my nose, suture my cartilage together, cut my adder,
and
my nasal adder, and put them together.
Wedge resection to your adder. Wedge
resection. Take a little bit of my lower.
We have to gather and cephalic rotate your tip.
Okay. Oh, the rotation of the tip. So basically, it means that we have to cut a little bit of my cartilage, put it together, and because my tip is going down, we have to rotate it up so I can have like a little perky nose. Mom, I'm not gonna keep my promise. I'm gonna get something done in Korea, maybe.
Maybe not.
지금? So, which conditions would make someone not suitable for invasive plastic surgery?
Actually, there's no patient not indicated in invasive plastic surgery, but it depends on the expectation of patient. So the patient don't want to have invasive surgery and they only need some change in your nasal bridge or something. So we recommend nasal dorsal fillers or some threads in some cases. Most patients and most people start with the non-invasive surgery, but some of them are satisfied with the results, but some of them are not satisfied or have more desire to
make it permanent.
So they change their mind and decide to get invasive surgery.
For example, if I, as a patient, say like, oh, I just want fillers, right?
Yes.
But then I don't like exactly how I looked. Do I have to wait the year, 6 months until they dissolve, until they are absorbed in my body, or you can do something to take them out?
Actually, there's various types of fillers, which is absorbable or non-absorbable. So, absorbable fillers are made usually with hyaluronic acid, which is resolved by hyaluronidase.
So people, if you don't like it, if you say like, oh no, this is not for me, this is not the nose I wanted, you can get them dissolved and you don't have to take all the 4 to 6 months that it takes for hyaluronic acid to be reabsorbed into your body naturally. So if someone just came and said like, oh, hi doctor, I actually got permanent fillers, like PMMA fillers in my nose, and I don't want this anymore. What can you do to help them?
So, most cases we have to remove the permanent fillers with surgery, and after that, simultaneously we can do
the nose job that they wanted.
Yes.
Okay. So we already know like when to put it, He already told us, depending on your preferences, on the time that you have to recover, what changes do you actually want in your nose. You can go like either permanent or not permanent, right? But here's the thing. A lot of people are scared of plastic surgery itself because obviously it's invasive, it's a surgery, you have to go through anesthesia. What are the risks of getting a rhinoplasty? So people can make an informed decision on what they want.
Most significant and risky side effect is infection. It can occur on the silicone insertion or other implants.
Bleeding.
Actually, short-term side effects can also have bleeding or pain things, but it can prevent most of it.
So it's not like I'm gonna die from getting a rhinoplasty. Yes. Like science has advanced, people. Like techniques have advanced. Like you're not gonna go to a rhinoplasty and not wake up.
Actually, most important side effects of the rhinoplasty is unsatisfactory results. That is most important and most frequently occurred one. So we have to consult very deeply and long time, discuss about their expectation or need or desire, what height they need, what projection of tip they need. So we have to have enough consultation time.
Something that I've been very adamant before is that I usually told all of my friends is like, if you want to get your nose done, go to an ENT. Like they're the ones that know how a nose should look, how it should function. And what is your input about that? Like, should people go to a plastic surgery or an ENT? Tough question.
I believe I'm plastic surgeon, so I believe more aesthetic outcome or concern when good aesthetic outcome can made by plastic surgeon maybe, but it depends on the experience of the surgeon, each surgeon.
Okay, now we have the honest opinion of a plastic surgeon.
We have to see another ENT doctor.
Now we have to go to an ENT.
I have many friends in ENT clinics, so I have to be careful with my mouth.
Oops, I'm sorry. It was great talking to you today.
Oh, yes. Thank you.
Thank you for answering our questions. If they help some of you decide whatever you want to get done in your nose, I'm happy about it. Okay, so this is the end of the video. I hope you guys like it. If you did, please subscribe, hit the notification bell, and please comment so we can make videos that you want to see and your questions about like plastic surgery and cosmetic procedures here in South Korea. So this was all for today. So thank you. Bye.
Bye.